So I see a lot of patients with complaints about the knee. Some of those complaints are from acute injuries such as a fall or an accident while playing sports, and other injuries are more chronic or what we call overuse injuries from either too much sporting activity or too quick of a start in a new activity or new sport. One of the more common complaints that I get is clicking or sounds in the knee. People are often very concerned about those, and I can say with confidence those are rarely a problem. Most clicking or sounds that come from our knee or other joints are actually pretty harmless. When people start to have painful clicking or even pain without clicking in the knee, that sometimes can be a sign of a problem. Although it's reassuring to know that many of these symptoms in the knee, whether it's pain or minor swelling or difficulties with activity, can be treated without surgery. Often, just as we discussed in the shoulder, anti-inflammatory medications, resting from activities that are causing the pain, as well as physical therapy to rehab all the muscles around the knee can effectively treat knee problems. When you start to notice more advanced symptoms in the knee, such as swelling where the knee balloons up, clicking that actually hurts, or where the knee starts to ratchet or lock in place, those can be a sign of ongoing damage to either the cartilage or meniscus and may need to be investigated further with a physical exam or MRI. When we discuss more acute injuries, such as a sudden onset of pain and swelling on the soccer field, or pain and swelling after a car accident or a fall from a height or down the stairs, then we worry about what we call tears in the knee. And that could be anything from a tear in the meniscus to one of the tendons, quadriceps or patellar tendon, or the ligaments in the knee. While not all these injuries need surgery, most of them should be evaluated by a knee surgeon to be sure there's no injury that will result in chronic pain or chronic disability. So while it's often intimidating to think about seeing a knee specialist or a knee surgeon, a lot of my patients are worried that when they're referred to me they're going to need surgery. It's often not the case. But again, I think it is important to get your knee looked at and look at your treatment options. And I'd be happy to speak to you about those anytime.